Welcome back. Medical technology affects us in everyday life in many ways. Today we are going to introduce a small part of it. Here to tell us more are Daniel Nasser, a technical manager at KMH Labs, and Vijay Kanwar, president and founder of KMH. Welcome to the show. Thanks for coming.
Thank you.
So Vijay, why don't you start off? Tell us a little bit about what your organization does.
Well, Catherine, on behalf of KMH Cardiology and Diagnostic Centers, we are pleased to present this education session regarding PET imaging. KMH was founded in 1988 with a mission to set new standards in the delivery of comprehensive, efficient, and cost-effective healthcare services with a commitment to excellence in service and high quality. With cancer and the heart disease being the leading cause of death in Canada, our advanced state-of-the-art PET scanner can transform the way doctors diagnose and treat cancer and the heart disease. A PET scan can be used to evaluate the presence of cancer, detect whether the cancer is isolated to one area or has spread to different organs, and assist in determining the best method of treatment. A PET scan can also be used to evaluate if damaged heart tissues can be repaired after a heart attack or if it has become a scar tissue.
Okay, now Daniel, I understand you sort of specialize in PET scans.
That's
Can
right.
you tell us a little bit more about, first of all, what exactly is PET?
Well, PET stands for positron emission tomography.
And I think we've got an image that we're going to pull up here. Yeah, here we go.
That's right. And what a PET scanner really is, it falls under the nuclear medicine imaging technique.
Okay.
And what you do pretty much is you give a radioactive tracer to a patient, and as that radioactive tracer travels through the blood system, it localizes into areas of interest that you want to take picture or regions of interest, and you are able to produce an image on a screen to be able to see and diagnose if there are any sort of abnormalities in comparison to a normal image.
Okay, and how exactly does it work?
What you want to do is, as I had kind of described in the beginning, you need a tracer in order to be able to view any images under a PET scanner. A PET scanner is a detector. It's not a camera that gives off radiation.
Right.
It's an open image. It's almost like a donut where it has open ends. You give a patient a tracer, and a common tracer that is used is known as fluorodeoxyglucose, FDG. By the name of it, you can already see that it has sugar inside of it.
Right.
And that sugar localizes in areas in which it needs to uptake sugar for its energy. One of the areas that where we are targeting are tumor cells.
Okay.
Tumor cells need energy. They need to take sugar in your diet. And through this radioactive injection that we inject into the human body, it uptakes these radioactive sugar, and it localizes in certain areas where we want to be able to image the tumors. Now, tumors such as the ones that are benign and the ones that are malignant, we can differentiate at the stages in which it is at. Unfortunately, if it has metastasized, meaning if it's malignant,
right,
it has been transferred into different areas of the body, either through blood or lymphatics, then we can determine to what extent it has metastasized, it has been spread into the body, if it's the bone, the liver, or any other organs within the body as well.
Now, I understand this is sort of an advance on the CT scans, which were used before. Is that correct?
That's right. So what they used to use prior to PET scanners were X-rays, CT, ultrasound. There were also SPECT, which is known as a gamma camera, single photon emission tomography. And what they do is they use similar techniques. With a CT and X-ray, it's a machine that gives off radiation to the patient. Where opposed to PET and gamma camera, it's just a detector. And all it looks for is to see those those radioactive emissions that are given off the body to be able to produce an image.
Okay. And let's just pull up the image there now. I think we've got, so this is sort of an example of the advancement.
That's right. So you can see how it starts off with an X-ray and moving on all the way to the future. We can see how PET is the way the future is going in. And that's one of the things that we are hoping to be able to have more readily available and within Canada, is because how it is so efficient and for us to be able to diagnose stages of cancer that a patient is diagnosed with. And moving on forward, we can even detect heart diseases.
Oh, great.
At KMH, where we specialize a lot at cardiology, we have a state-of-the-art PET CT machine, in which we're using currently for such as things that to stage cancers within patient body, and as well to be able to use it for neurological disease such as Alzheimer's that we can see in a lot of patients that are 75 and over. And we know that 1 out of 5 people are diagnosed with vascular disease, and we're even using that with vascular disease.
Oh, that's great. Now, I understand, why don't you kind of take us through the process of how exactly, if one was going for a PET scan, kind of from start to finish, exactly what would occur?
Well, first, the patient who arrives, there's different scenarios. I'll explain one, a patient who comes in for a cancer, oncology patient. The patient arrives, we like to see the sugar level of a patient to see if their sugar level is high, because we are already injecting sugar molecule into the patient. Once the patient is given the tracer, based on knowing the fact that the sugar level is balanced, we allow the patient to wait for about 60 minutes. And during that process, what we're allowing the radioactivity to be localized in areas which we would like to see. It is also important for the patient to be very comfortable during the time that the injection is received, because, as you know, sugar also goes to the heart muscle and other muscles of the body. So you want it to be as comfortable as possible, the radioactivity to be localized in areas of interest, and then you place the patient on the camera, and from there on forward, it depends on which area you're taking a picture of, and the pictures can go anywhere from between 20 minutes to 30 minutes. Okay,
and now it also works for heart disease, correct?
That's right. So that's something I can also describe to you about. A heart is basically a pump that is within the body, and it just likes to circulate the blood to every area. But at the same time, the heart itself needs to receive blood. And those are the coronary vessels, or the coronary arteries that supply blood to the heart. So if any coronary artery, or if a major branch of coronary artery is blocked by some sort of clot, there will be a major heart attack on the patient, which is known as an infarction. Now, the blood that is received on the heart muscle has to be oxygenated. So if there is no oxygen being received in that area of the heart muscle, then the patient is going to have a severe damage to the heart. What we're capable of doing is giving radioactivity to the patient and to see the spread of this radioactivity in the heart muscle. If an area of the heart muscle does not uptake that radioactivity, then we can, based on the images, determine, okay, well, if this patient had radioactivity received at rest, and now we've stressed their heart with a medication, excuse me, and we want to see how much radioactivity there's a difference between the rest images and the stress images, we can see the degree of blockage within the coronary arteries.
So really with the PET scanner, it's like the whole sense of the imaging is just much more advanced, so you can see kind of where the problem has progressed to, is that right?
Definitely.
Okay, great. Now, is this covered by OHIP?
It is covered by OHIP. There are certain restrictions as well that we have that unfortunately that we would like to move forward to as the PET scan becomes more readily available within Ontario. We know the fact that eventually there will be other scans that will be available by OHIP to cover them. There are certain oncology, such as the ones that I'll just mention a few to you, such as things as germ cell, tumor. There are other ones that are associated with lung cancer that are covered. But there are a few other cases that is still being staged, and it's in research to find out at what point they will cover these.
So it's sort of in development currently.
Exactly.
Okay, and now is the radiation harmful at all?
Well, the thing is that's something that's determined by the physicians. Not every patient is sent off on a monthly basis to be just going through a PET scanner to receive radiation. It is what is called the risk versus benefits. If it's more beneficial to the patient, then the physician will send that patient off to a clinic, and they will be scanned to find out the stage of the cancer and what treatments are necessary to be taken. The advantage of PET is you can actually determine to block off unnecessary treatment that the patient doesn't need to receive. If a patient receives an FDG dose and we diagnose exactly where it is located within the lung, we can actually give, in reference to the organs that are around it, we can give exactly the slice number, and then that way the oncologist who receives the CD will exactly know where they need to target the radiation therapy or chemotherapy if the patient needs it.
Okay, great. And now how readily available are these machines in, for example, local hospitals?
Local hospitals, there are only few hospitals that do have this PET scanner. PET scanner are now, because they have advanced, they're always in conjunction with another scanner, so it's either a PET CT or a PET MRI.
Oh, okay.
And what it enables you to do, the PET portion allows you to be able to see the function of the tumor or whatever you're trying to visualize.
Right.
And at the same time, the CT or the MRI shows you the anatomical perspective where it is located. And these images are fused on top of each other.
Oh,
They're taken
I
at the
see.
same time. Patient saves time, and instead of going to CT and PET,
Right,
they
can
get it
just do
done at
all
the
in
same
one.
time. And that
Okay.
way, the physician who sees the results can determine what sort of progress I want to take or necessary actions I want to take from here on forward.
Okay, great. Thank you so much for coming, guys. And if users want to find out more, they can check out your website, correct?
That's right, www.kmhlabs.com.
Okay, great. Thank you so much for coming. And tune in next week for the show. Everything is always changing in the world of technology, so there's always lots to talk about. Thanks.